It is car 959. We're on the street, we're on there. And on Fridays, as you know, we do celebrate South Africans, our favorite South Africans. And I love the fact that social media makes it easy for us to meet them. Back in the day, Kamo Tjelele, I was supposed to sit here with a newspaper, with a magazine, piles and piles of magazine to try and find these amazing people.
Yeah.
Was social media knock you? The real sitter, Motushu. Who is this young man? Dr. Tjelele, hello.
Le guy.
Ke botsa wena.
Na ke right.
Na ke pela hao.
Ke thabela ba mo.
Ska tshwa ngwaneso.
No,
Ha watla doctor.
Yeah.
I've got nothing but good news for you.
Okay.
You're going to live long.
All right, thank you.
Is it? Isn't it the science though? Isn't that the objective of the science?
To live long.
Huh?
Unless you are healthy. If you're not healthy, then life's going to be shortened.
Yeah,
That's
but
a sad reality.
Mara health is subjective.
It's not subjective, it's objective. That's why when you come to us, we objectify it.
You live long depending on your diet.
That's true. But then what if an accident happens?
Things that I can be in control of.
Or what if you come for your routine checkup and then we find something? You see that one?
Come closer.
When it comes to the afterlife, that's where we stop.
Yeah.
Only when you are alive.
But what is the objective of medicine?
Is to keep people healthy.
Yeah.
And have them live a long life. And if you're unhealthy, to help you to be comfortable.
Yes. So when you are unhealthy, so basically what you guys do is that let's manage this unhealthiness to extend your life a bit.
Yeah, we manage it to keep you comfortable if your disease is causing you pain.
Yeah.
And other stuff we can cure, luckily.
Yeah.
Other stuff we
But now let's go to why your TikTok videos. I mean, what's behind that?
So my TikTok videos, they're inspired by two things.
Yeah.
To simplify medicine for my colleagues and to simplify medicine for the general population.
Okay.
I find that when I see patients, they come to me and they're like, you are the first doctor to explain this to me. I never understood what I have, and now I understand why I need to take my treatment. So sometimes what we do as doctors, we don't simplify the medicine.
Yeah.
And hence the patient...
Throw terminologies.
Exactly. And so we sound smart.
Yeah.
And hence the patients, they leave there not being compliant to treatment. But then
it's no longer about what I came in for. It's about me remembering what you said. And that word is now my my friend in my pillow, so to speak. Yeah.
Exactly.
So I saw one about hypertension.
Okay.
How you simplified that. For those who missed it, what is it?
So high blood pressure, right? It's when your body, in the blood vessel, I don't know how deep must I go with this, right?
Yeah.
Yes.
No, could make it simple so that somebody says, I need to go in.
Yes. So your body has pipes. Those pipes, they deliver blood, right? So when your heart pumps, and high blood pressure can have a cause that we know and a cause that we don't know, right?
Yeah.
So hence when you come in and we see you have high blood pressure, we need to ask ourselves, why do you have high blood pressure? Are you maybe in pain? If you're in pain, that high blood pressure might resolve. Do you maybe have a disease that's causing you to have that high blood pressure? Hence we need to take those bloods and examine you fully. You understand? So it's when in your blood vessels there's an increased pressure, and that pressure can cause damage to your heart, can cause damage to the blood vessels in your brain. That's why we talk about stroke with high blood pressure. Can cause damage to your kidneys. That's why we talk about your kidneys as well. And it can cause an overflow of blood so that even your legs, they become swollen up and all of that. So it's increased pressure.
Yeah.
Yes.
In your system. Caused by
the heart that's pumping. And when your heart is pumping, it now translates into your blood vessels. And when your blood vessels now have this high pressure, that's where we measure you, where you have your pulse points, right?
Yes.
And then when we measure that pulse, which is coming from your heart, we see that the pressure is increased.
Yeah.
Yes.
Why is the mind part of the problem? Because when you are stressed, your blood pressure.
Yes. So remember, when we're talking about the mind and we're talking about the heart is autonomous, but also working with the mind, which is the brain. Right? So whatever stressful thing that you can receive.
Call the mind. Whoa. So the heart, is married, but not necessarily in community of property.
Yes.
It can decide on its own.
Do you understand? So that's why even...
Guys, Lampona, I'm going to take a medical exam after this. Okay, so...
So that's why even with people that we do a heart transplant with, the heart is no longer connected to the brain, but the heart can still function. So that's what I mean, that it's connected to the brain, but it's autonomous.
Yeah.
So with stress, it has to do with the immune system. It has to do with the release of hormones, stress hormones.
Yeah.
Do you understand?
Yeah.
So when you receive that perceived stress, your body needs to respond.
Yeah.
That is why your mouth can be dry. That is why now your heart rate increases. Do you understand?
Yeah.
Because of all of those hormones acting up. So stress is telling you are in trouble, you are in danger, you need to run away.
Yes.
You understand? And now your heart needs to pump fast. And when your heart now pumps faster, it increases your pulse, it increases your your blood pressure.
And when you're not running.
And you are doing that every day, and hence now it can be one of the causes for high blood pressure.
So unwile energy drink, marodu just tell.
Do you understand? You are not utilizing that energy.
Yeah.
So that's why people did not understand that video that I did on energy drinks.
Oh wait, yeah. What? I can read your connector, like the heart to the mind. Wait, so that I saw that video. You're talking about energy drinks. Let's go there. Were you focusing on the content of the energy drink, or were you focusing on what it does to the body?
I was focusing on people utilizing energy drinks when they don't need to do so.
Tell me.
So you are creating a bomb with those energy drinks in your body, right? It increases the energy in your body. It's very high.
Okay.
But you're not using it.
O charges the battery mara.
Do
Chiban.
you understand? So that's the issue with energy drinks. You are using it every day and you don't have a good hygiene in terms of your health, meaning you don't have energy during the day because you don't sleep well enough, or you drink water before you sleep, or you sleep during the day, or you drink coffee and then you want to drink energy drinks. Those things is just a vicious cycle that will cause you to end up having health issues.
Yeah.
Yes. So I only tried to say that you must take energy drinks when you need to do so.
Yeah.
I drink energy drinks.
You do?
Yeah.
When?
But I don't abuse it.
No, when?
So I will drink an energy drink when I know that I'm going to have like a 24-hour shift and I've been working during the day and I can feel like I'm declining. And I'm like, let me just help my body just stay up a bit.
Sure.
Yes.
Okay.
Then I can function well.
Why medicine? What made Kamo go grade 10? Our mother, father, nah. This is where I'm going.
So, when people see me today, they think, I'm smart. I can see it also on my TikTok. They think I know everything.
Yeah.
And I don't know everything. I only know what I know.
Yeah.
And I'm a student of life.
That's right. Yeah.
So I never liked school.
Really?
I never liked school at all.
It's strange. For a physician.
I never liked
qualified.
Yeah, I never
certified.
I never liked school. And I used to fail. My report card came back with those circles.
Yeah.
Yeah, saying failed mathematics, failed physics, and all of those things.
And then what happened? What changed it?
My life got transformed by a physical science teacher when I was helping him to close the windows. And then he asked me, how did you do? I'm like, no, I failed there. You see, 22%. It's not even the 30% of today.
Yeah.
That was 22%.
Trenda.
And then he looked at me and said,
you were far below the national average before the national average.
Before the national average. And then he told me, Kamo, you can make it if you can start doing your homework and studying. That transformed me for you to find me where I am today.
But I'm sure some other teacher also said the same thing, but you didn't hear him or her. Why this one?
No, those other ones did not. They were not saying those things. They were telling me I need to leave this subject and stuff like that. I don't deserve to have mathematics and stuff like that. This one, it was just genuine what he was saying.
Yeah.
Yeah, he just told me.
It resonated with
Imagine I've failed. You can see the 22%. This person is a failure. Far worse. But then he's telling me that you can make it if you can start doing your homework and start studying. And he was speaking the truth because I knew I wasn't doing my homework and I wasn't studying.
Yeah. So he kind of knew that you are smart. You do have the brain capacity for this thing. You're just not applying yourself.
I don't know what he saw, but I think this is the principle of life, right? sometimes we need to identify the light that exists in people and tell them you actually have light. That's what I do at my work. You actually have potential. Your life is not over. And that's what he did with me.
Yeah. And versus what was said at home. Because go ahead, I want on this report card.
So at home, I was raised by my grandmother, who was a teacher. Yeah. So when she saw me failing, she never screamed at me. She never beat me. She just said, Papa, ustodo. You understand? And I know you're not studying, and I know that this doesn't reflect your capacity.
Yeah.
This doesn't reflect your brain.
Yeah.
And yeah, that's what they said at home. They were always supportive, failing, doing well.
And then come matric, you do well.
Come matric, I do well. And every the semester, what did we used to call it, matric, the teacher was always proud of me. He's like, no, I can see you guys, but Kamo. You understand? So why medicine? I just enjoyed life sciences. It's one of those things that I could understand without studying.
Yeah.
It was like just.
So your brain was wired for this thing.
It was just wired for this thing.
Fast forward to Cuba. How did Cuba happen? Because we know of stories, or we know of a program where the government took some of our people to Cuba to go study medicine.
So how Cuba happened was that, so my mom passed away when I was 10.
Condolences, yeah.
Thank you very much. And she was a nurse, actually.
Oh.
At the same hospital that I was working at. And so obviously she had friends there.
Yeah.
So my granny, even though she was proud of me, she would tell, the people there, like, no, he wants to study medicine,
Yeah.
So there was one nurse who said, I saw this advert, let him apply. And that's how it happened. Never looked.
So wait, so were you've already done some education or training in medicine?
No.
How come were you working at that hospital?
No. I'm saying, I've just fast forwarded in the future.
Yeah,
I've worked at that hospital when I was doing my internship recently.
Yeah,
but that was 2014. I did my internship now in 2023.
But wait, this is before or after Cuba?
Internship?
Yes.
It's after.
Take me about, I want the story where, how did you end up going to Cuba?
So the colleague of my mom who passed away,
yes,
is the one who saw the advert at the hospital
and gave it to your mom,
and gave it to my grandma. My mom had already passed away.
Oh yes. Sorry, yeah.
Yes, and then that's how I applied. Whilst I was still in matric there, so I was already set. I'm going there. My grandmother's not gonna pay anything and stuff like that.
Wow! And you were taken.
And I was taken. 850 people applied. I had to choose the cream. Only 112 went.
112 from 850. Wow. The guy who didn't do his homework made it.
Exactly. So it reminds me as well, when I was speaking to a patient who had these panic attacks, that's also a brain issue, a psychological issue.
Yeah.
And I ended up finding out it's because of academics and all of that.
Yeah.
And I was like, how did you do in matric? Then they told me 40% there. I'm like, that doesn't reflect who you are. You can still go back and upgrade. You understand?
Yeah.
And they were like, no, it reflects who I am. I'm like, okay, fine. What about the person who had those 40%, went back to rewrite and got 80s and 90s? So do you see that if that person had those 40%, it was not reflecting who they were, because the same person now got the 90s.
Yes.
So your failures must not determine who you are. It's just lessons that you need to learn from those failures.
So you're in Cuba for how long?
6 years.
So Espanol?
Yeah, estoy hablando el español muy bien, como el cubano.
They make no sense.
Yeah. No satsuwa.
Yeah.
And it reminds me, 2 days ago when I was on call, meaning my emergency and trauma shift.
Yeah.
There was a patient who was there to see how valuable this program is.
Okay.
And this patient could not speak any English and was speaking Portuguese. I know Spanish. It's Portuguese and Spanish almost
They're
similar.
cousins. Yeah.
So I was able to speak to that patient. And the patient wanted to unalive themselves. But I made them to smile now because of
somebody
trying
says,
I understand. And treating them as a human being. That's another thing.
Oh, now what you just said made me think. Being a medic, yes, you're dealing with humans. And I'm thinking public hospitals, right?
Yes.
At a public hospital, the more we come in, you start seeing less of humans and seeing a conveyor belt of products that you need to deal with.
Yeah.
How are you able to detach yourself from that mentally and remind yourself that I'm dealing with a human being?
So
all the time.
So for me personally, and that's what I always tell my people, life is about respect. Do you understand? I respect you, you respect me, and we are all human beings. And I always tell this to my patients as well, especially if we follow the principles of family medicine, the Batupele principles.
Yeah.
You understand? And the patient's rights charter. If people and all doctors were to adhere to those things, then they'll understand the king and the queen is actually the patient. The patient is the client, and you are there as a servant. But it's reversed. When you now see patients coming in, they see you as a god.
Yes.
They are respecting you.
Yes. And your word is bond, man.
Exactly, you understand. And I always try to break that with patients and say, no, I'm not better than you. We are all human beings. And that's what my TikTok also tries to do, to show people that I am a human being just like you, because they are surprised. Hey, this doctor laughing, this doctor making jokes.
Yeah, because they're always serious.
I'm your brother. Nothing changes.
I'm afraid to go to this men's surgery because diawada. Kamo. What's alanga peanuts even? Yeah.
Yeah, they are hurtful songs.
Why are they hurtful? Okay, no, you let him know nothing.
And I get groovy.
What do you mean how groovy? You don't about dampile wrong.
But I get that too much.
Too much ink?
Too much, nje. Ke spoiler haholo.
O tempetse re mo spoiler haholo.
And then you're not going to say it.
So
the same for me.
So
so alright.
What do you mean, Alwen?
I cannot say that. I just left it like that.
But and you talked about earlier on, and this is, I want us to come to how you manage your life over and above this calling. Because, I mean, for somebody to pull a 24-hour shift, it must be a calling. Because now it's beyond mereko.
It's the money calling.
I was smiling, shyly so. Or is the money calling? Is it really?
Sometimes it is.
Yeah.
Passion is the one that will keep you to still be kind to
Come
people.
Closer there, yeah.
Yeah, passion is the one that will still keep you to be kind to people. But money is a motivating factor as well.
Yeah. Burnout. How do you deal with that? Does it hit you?
On a personal level?
Yeah.
I'm not sure. We are on air now. I don't like telling people that I'm a workhorse. Yeah, I know I can work.
Yeah.
After 24-hour shifts, I can go around in Sandton, go to a restaurant, go play around in the mall.
Yeah.
Yeah, I'm a workhorse.
Same here.
But for some people...
You and I are made from the same cloth, my friend.
Yeah, for some people, it might be an issue, especially being frustrated with sometimes the working conditions and all of that. And also the backlash that might come from patients due to the slow service and all of that. You can end up being, have that burnout.
Because you're human too.
Exactly.
Right? Does a doctor need a doctor?
Yes and no.
The no part?
The no part, I mean, for the day-to-day visits, I can't visit the doctor for a flu or for some, let's just put it there, for a flu or for things that I can see what they are. I don't need to visit the doctor.
Yeah.
We usually visit doctors because we want a sick note as well. So we can't write.
Hey, Lekwele. Doctor goes to a doctor for believer.
Yeah. So unless it wants specialist care, that's when now we go visit the doctor, because that might be beyond you.
Energy drinks and manhood.
So that's a good question. So that has to do with what we call ED, erectile dysfunction.
That's right.
So one of the causes for erectile dysfunction, as he has mentioned, is chronic diseases.
Yeah.
Like diabetes.
Yeah.
It's being overweight as well. It's smoking. It's taking alcohol.
Yeah.
You understand? Yes. So and hypertension.
Yeah.
So how energy drinks would link up with that is chronic use or long-term use of energy drinks.
Yeah.
Will put you at risk of developing high blood pressure, which we call hypertension.
Yes.
And that in turn can end up affecting your manhood.
Yeah.
Yes, that is why before someone wants us to give them pills to help them with their manhood to say amandla.
Yeah.
First need to check, don't they have these chronic diseases? Is their testosterone maybe low?
Yes. Because that could also be an issue.
That can be an issue as well.
So are you saying Kachajila match has no energy drink?
Be careful.
Weekend away nyana.
But maybe once.
Dr. Kamo Pilato. Me out.
Maybe just once, but not long-term use.
Yeah.
Just get yourself checked with a doctor to see everything in check. As long as we don't have high blood pressure, then we'll still be fine.
One of your videos that I think is also doing quite well is when, by the way, if you just tuned in, this is Dr. Kamo Tjelele. Follow him on TikTok and see his videos where he just basically breaks down all these complex medical issues in so simplistic of ways that makes you feel like, why didn't they tell me this earlier? He's here today. Now, herpes, cold sores, or flu blisters as we call them.
Yes.
What's the difference?
So there is no difference between herpes simplex virus, or what people call out there herpes, and a cold sore, a flu blister, and a fever blister.
Yeah.
So how you got the herpes, it really doesn't matter. What matters is you know what it is, and you just come in so that we can treat you. So herpes, whether you got it from the time when you were born from your mom, or you got it from touching contaminated surfaces, or when you were busy, with love.
Oh!
Yes.
Yes.
Oh. I understand. When you were busy with love.
Put in your mouth where your foot is. Okay.
So when you get this herpes, we'll see it with those blisters, right? So it will first start off with a tingling, burning sensation that people will notice, and then you'll start forming these blisters. They are multiple, and these blisters, they are filled with water. Then that blisters, they will burst, and then you'll see a gush of water, and then when it dries out, it will be a yellow crust. Is what we see with people. Then it will resolve itself within 7 to 10 days. Or you come to us, we give you an antiviral, then it will resolve much quicker because they are painful. That's the thing. That's why people come, right? Wherever they are painful. So afterwards, no. If the mouth is going to touch somewhere else, they're going to be there. Wherever the blisters touch, it will be there. Yes, that's why you can't just say it's just HSV1 for the mouth and HSV2 for the genital area. No, can be mixed up depending.
So this home remedy,
it's just granny medicine. It's granny MBCHB. They say the grannies, they have their own MBCHB. So it's granny MBCHB.
Yes.
So what happens when it disappears but into your nerves. You understand? It goes into a remission there. It goes into a latent phase there. And then it will reactivate due to various reasons. Stress can cause it to reactivate. They don't call it a stress blister though. Infections can cause it to reactivate. And hence with infections, a cold, when you have flu, we call it a cold. Hence, when you have a cold, it reactivates. That's why they call it a cold sore. When you have a flu, it reactivates. That's why they call it a flu blister. And sometimes with infections, you can have fever. That's why they call it a fever blister. So they have associated the reactivation due to infections with the blisters, not knowing that it's actually herpes.
That's right.
And also hormonal changes, and the sun can reactivate it. So
just the sun?
Yeah, the sun, ultraviolet light.
Yeah.
So that's where the confusion is coming from. Yes, because now I have flu, which is a thing that can reactivate herpes. So they're like, no, it's just a flu blister. No, it's herpes reactivated.
So wait, this grandma MBCHB,
Yes.
this thing
No, that's just how it works. It will go to your skin, and that was the first. So where it appears, it's where the infection happened, from wherever where you got it.
Okay.
You understand?
And
then after it has done its process, it will go back, retrograde, to go back into the nerve. The nerve is like a pipeline. And then it hides in the trigeminal ganglion if it's there in the mouth, or the sacral ganglion if it's down there below. And waiting for it to be reactivated. Someone to say, stand up. And then it will stand up. Flu says it must stand up.
Enemy number one.
So it doesn't have a cure. So you can try and take antivirals to keep it there at bay, or when you have it, for us to
It's like having a grudge with someone you think is done.
Yeah.
Yeah.
You understand? So the only issue with it is pain. It's very painful. So
Yeah.
hence they come in.
Yeah.
Consult, yes.
I don't know what other issues are there, but I think of late we're dealing with a lot of lifestyle issues. Hypertension is a lifestyle issue, isn't it? What else?
So when you're talking about lifestyle issues, that's when now we come to patients and tell them, no, you need to have a lifestyle modification. If you see them on my TikTok, they hate that word very much.
Hi.
Yeah, they don't like it. They're like, back ideal about doctor. They've started again with lifestyle modifications. Why? So lifestyle modifications, it has to do with, as we've said earlier, your diet. You understand? Some people come in there into my consultation room at public service and they're saying, doctor, I have constipation, right? And some of them, it has complicated this constipation to even forming what we call hemorrhoids, which are piles out there.
Oh.
You understand?
Yeah.
And I'm like, listen, the medication that we're going to give you, right, it doesn't really treat these piles that you are having. You understand? If you now have piles,
yeah,
it's just going to treat the symptom, right? So it's going to kill sensation down there so that when you do number 2, you don't feel pain.
Yes.
And the other one's just going to soften the stool so that it's just nice and soft.
Yeah.
So it's not treatment. And then for constipation as well, the actual medication that we give, if you take them long term, because you're not adhering to lifestyle modifications, they can end up causing you constipation. The same medication.
The same very medication that's supposed to help you. Yeah.
So lifestyle modification is your diet. Constipation, water. Increase your water intake. Number 1. Number 2, increase your fiber. Yes, and so your fiber. That's why I told them Weet-Bix is not just.
And a fiber, like a Wi-Fi.
No, not the fast internet.
Yeah.
No.
Yeah.
That's why I told them that Weet-Bix is not just for children. It's also for you. Eat those Weet-Bix. Eat those fruits and those vegetables to increase fiber.
Bro,
do you understand?
Fruits, vegetables.
So that
nyama. Oh, one more.
So that's one of the issues, right? We're talking about erectile dysfunction as well. Obesity is an issue there as well for high blood pressure and other diseases as well. So people need to be mindful of their weight. And how can you also be mindful of your weight? Apart from if maybe your overweightness is caused by a genetic issue, is your diet as well. That's why I tell my patients, you are what you eat. If you can fix what you are eating, then you'll be better.
You're sounding very personal. You are what you eat.
You are what you eat. That's why the father of medicine, Hippocrates, said, let food be thy medicine and thy medicine thy food. That's the father of medicine. We make an oath in his name.
I told you at this man's room, the hour. This is Jazz Works. Is this Waganjan? And a very good question for the doctor. Is this Waganjan? You could try run this morning. Are we ever going to see Dr. Kamo Tjelele room? Are we ever going to see at Kamo Tjelele's hospital? What's the plan for the future?
So the plan for the future is to move into private. And
currently you're public, right?
Currently I'm public, serving the people.
Yeah.
And so the plan is to move into private and have my own consultation room. And the future is to have it to be a hospital. But we first start the model as a consultation room.
Okay.
To solve the problems of people the way I want to do it.
Yes.
So that when people come in there, they can feel respected, they can feel honored, and they can get the help that they need, not just a place that's going to use the medical aid as a ATM, you understand? Yes.
Is there room for alternative medicine in your practice? Because we've really seen that how you guys are trained, you're trained pharmaceutical route. There's an alternative space that is showing us that there's more to just taking a pill.
So to answer that question, and I think I've answered it before, we not only focused on pills. The reason why we are on pills with people is because they are not listening to us when we are telling them about general measures and lifestyle modifications.
Okay.
Do you understand? So that's where we start first. When someone comes in with high blood pressure, depending on what level the blood pressure is, we tell them, no, we'll just do lifestyle modifications with you first and trial you for 3 months. So our patients, they don't listen to us. And hence, and we have a big load. And hence, we just start with those
pills,
pharmaceutical pills.
Interventions,
yes.
Yeah.
For me, and I have people approaching me, brands approaching me with, their thing, like wonder pill that can work and stuff like that. I need to see the science. Because remember...
Because side effects is a huge issue. Yeah.
We are scientists as well.
True.
Our things need to go through clinical trials.
Yes.
To make sure that if we give you 100 milligrams, this is what's going to happen. And if we go over that, these are the side effects that we can start expecting.
Yes.
But these things that people talk about, they don't have a measurement. You understand? Hence, what people also don't know is that our pharmaceuticals, the pills, they come from plants. They come from nature. You understand? But we were able to dose it. So if you're just going to take the plant, you don't know how much of the active substance that plant has.
Yeah.
You understand?
Yeah.
You might find that today it has enough.
That's why people were getting poisoned during COVID, woodworm, because they were overdoing it.
Do you understand? So you can find you might have the 100 in this plant today, and tomorrow when you go pick that plant, it has 20. You understand? And then it might work for you, it might not work for you, it might cause you
so measurement is an issue.
That's the issue.
Yeah.
You see? But it doesn't mean that, we are against those things. No, because remember, we need to account. These people, they don't account to anything.
We
have to account if something wrong happens.
That's
why we can't dabble in certain things. Unless it can pass through clinical trials, then we can start.
Are doctors trained when it comes to diet?
In lower years, yes.
As in, you are able to understand what food does and how to... Can you even prescribe it?
Yes. Remember, this is what I like telling people. These people that we send you to, their degrees are within our degree.
Okay.
Just that
they are more specialized.
Not that they are more specialized. In terms of psychology, I had shown a patient once where I usually have to take like 5 to 10 minutes seeing a patient. I took 30 minutes with that patient.
Okay.
Because I did a psychological intervention with that patient, and they walked out smiling. But I told them that's why we can't do this. Because if I was to spend 30 minutes with you, given our patient load,
especially in public.
Hence, we need to send you to a psychologist. We work well with them.
I see.
Imagine now, we know how to dispense pills. When we are doing our emergency shifts, we are the ones giving the pills. The pharmacists, they are gone, chailenga for.
Yeah.
Do you understand?
Yeah.
But imagine now during the day, we see you, then you have to stand up and dispense you medication like a pharmacist. You understand? It's going to cause us issues. So we do need to know about diet and all of that. When they're in hospital, then you can't eat. We are the ones now who start thinking, all right, fine, let's give them this.
What about Dr. Google? Does that make your job easier or?
So remember, the Google question has come up, right? Google has sites that we use. You understand? To reference things.
Yeah.
Remember, you only know what you know, and what you don't know, you don't know.
Yes.
You see? And there are things that we remember that are in our memory.
Yeah.
And there are things that we know how to use, but we just need to see it again.
Yes.
And that's when now
to refresh.
Yes. That's when now Google becomes helpful because we know what to look for. We have our sites made by doctors.
Yeah.
You understand? To go look for stuff there. But a patient doing the same, that's why they come now and tell us, no, this is cancer. This is a stroke. This is a chest pain, because they are not trained to digest the information. Yes.
Yeah. They're not even where they get the information might be even a wrong place.
Do you understand?
It's not peer reviewed and all of that. Kamo, we wish you nothing but the best, my brother.
Thank you very much.
Thank you for your passion. Because, like I said, it's all about making such information accessible too, and making our lives easier. And the more you make our life easier, the more we want to see you. Because I'd rather go to Kamo. Because even if it's a headache, but Kamo might say, this headache comes from.
True.
You know what I mean?
Yeah.
Wish you nothing but the best, my brother.
Thank you very much for having me.
And then may that hospital happen.
Thank you very much.
And then...